Hello, I'm Judge Chris Macon, Ellis County Justice of the Peace, Precinct 1, and you're listening to Texas County Voice, a podcast for all 254 counties, and we thank you for listening.
Hello and welcome to Texas County Voice. I'm Lisa Ogle with the Texas Association of Counties. Earlier this year, TAC hosted its legislative conference at which I met Travis County Commissioner Ann Howard, who represents Precinct 3. When I invited her to be on the podcast and brainstorm possible issues to discuss, she mentioned homelessness and mental health. It just so happens that both topics came up during a conversation I had at the conference with an official from a smaller county. He noted the stark contrast of coming to Austin and seeing the abundance of homelessness here. Welcome to the podcast, Commissioner Howard.
Thank you.
What is it about the Austin area that makes homelessness such a big problem, and how is Travis County currently addressing the issue?
Well, thanks a lot for having me and to get to talk about two things that are very dear to me because they both, homelessness and mental illness, reflect, I think, suffering of people, and we should do all we can to eliminate that suffering. In Austin, we are not unique in our challenges with homelessness. Many large cities have a visible, unsheltered homelessness challenge. I think people used to could hide if they were without housing. They'd live in their car, in a parking lot, they'd live in the woods, and we have fewer places to hide today in our community. We also have a lot of people living in downtown Austin. And 2 decades ago, that was not true. And so at night, you didn't really know what was going on. You didn't see people searching for food in dumpsters because there was no one downtown after businesses closed and restaurants closed. But now we have wealthy people living in high-rises, and we have people without homes, and they're all very close together. So I don't think we're unlike other big cities who have this problem, but we have a rather small footprint and a lot of visitors as the state capital and the home to the University of Texas and Dell and Tesla and all these exciting things, also a lot of outdoor festivals. And so we have a lot of people here, and we have people that can't afford to live here any longer. So it's the challenge.
Why is it that so many of them are staying in the downtown area?
Well, we've looked at that a lot. We've reduced the numbers a bit, but the Salvation Army had a large shelter downtown Austin. On that same block was our Austin Resource Center for the Homeless. Across the street from that was Caritas of Austin, which serves people experiencing homelessness. Our churches downtown are very compassionate and provide services to people experiencing homelessness. It's a natural place of density, and people who need help are looking for help, and they're going to places that offer help. We also had strategies back in the day where if you slept in a shelter, you had to be out early in the morning looking for work, doing meaningful things. And that emptied our shelters and put all those folks on the street. And so we've changed those policies where you do not have to just exit the building and stay out till dark. There's more services provided throughout the day in those shelters. And the footprint, we were way over capacity in the shelters, and we've now opened other shelters and reduced the number downtown. So I think it's a combination of that, of just where people were, how we provided services, and then the expansion of residential communities downtown.
What preventive measures is the county taking to reduce the risk of homelessness for vulnerable populations?
I've been working on homelessness for about 13 years, and that homelessness happens when there's a crisis for an individual or a family and income that's too little. You can't afford rent. And so you lose your housing. And that can be because of loss of a job, a loss of a relationship, a healthcare crisis that might have led to either of those. And so how then do you address that? How do you make your community more resilient in the time of crisis? So let's take a healthcare crisis that causes somebody to lose that messes up their finances, and then they can't pay rent. So you want programming that helps them get right back into housing. Rental assistance. We have increased access to rental assistance in Travis County. Another is to get more folks connected to health care, because that can help them not have to lose all their rent money because of health care. So the real focus here is the connection between housing and health care that helps you be more resilient. The other thing we recognize is just the access to jobs, job training, so that more people are making a living wage to be able to afford rent. So you gotta attack this from all angles. The homelessness comes in all shapes and sizes, just like we do. We've had a big focus on preventing youth homelessness, and I'm talking about for young people that are aging out of just hanging out with mom and dad, or out of the foster system, or leaving the juvenile justice system. We know that foster care is a big feeder into homelessness. So we've been trying to close that gap when young people are aging out of foster care. And I was really proud that Travis County earned one of the first grants from HUD, $5 million to tackle youth homelessness. We've been able to renew that funding. And prior to COVID, we were this close to just closing so many, linkages to make sure we didn't have young people falling into homelessness. But COVID really did a number on that, and we're still working to close those gaps. I think when you look at homelessness, you can see the failures of different government systems where it's supposed to be a safety net or helping folks, but it really complicates things. The justice system is another one. When someone has been incarcerated, it is very difficult to get housing, to sign a lease. And so as another preventative measure, it's working with people who are in our county jail and helping them plan when they come out, where are they gonna live? We've done a lot of education with landlords and property managers to understand that just because someone has spent 6 months in jail or 3 years in jail, it does not mean they will be a bad renter. They need to abide by their lease like all your other renters, but don't lock them out of housing, or we have a street homelessness problem. And so these are the dots that we've spent a lot of time trying to connect so that people see the full picture.
What long-term strategies do you envision to ensure sustainable housing solutions for those experiencing homelessness? I know you just touched on some of them.
You got to find the money to do any of these programs. And the way HUD and the National Alliance to End Homelessness, the Interagency Council on Homelessness, so from the federal level that passes money to the states and sets strategies and benchmarks, there's different ways that we look at homelessness and the solutions to it. One is for people who've experienced short-term homelessness. I mentioned someone who might have had an illness, causes them to lose their job, they got to get back into housing. That kind of bucket of strategies we call rapid rehousing. You want to get them back into the housing market as quickly as possible and give them a runway of up to 24 months of assistance to make sure that their employment, their benefits, whatever their revenue is for their family, their household, can pay rent. And the support services that they might need just to recover from that incident or that action that created their homelessness. So we call that rapid rehousing. That can work very well. The data is really good on that. For someone who's been chronically homeless, their episodes of homelessness are a year or longer, They may have an illness, a disability that keeps them on the streets, and that could just be an untreated mental illness, a long-lasting disease. Those folks do really well in just a much more intensive service package, and we refer to that as permanent supportive housing. And the permanency means that they get to sign a lease and they have a rental, like a voucher, to help pay rent. And that voucher sticks with them as long as they need intensive services. And those services often are a case manager that really sticks with them. Like, I'm talking about a caseload of 8 to 12 individuals. So the professional social worker has her hands full or his hands full with a caseload that needs a lot of help to maintain that housing and to be successful with their daily living. And that's permanent supportive housing. And that is often seated in a community with a grant from HUD and then supported by the local community. In Austin, Travis County, we have invested a lot of our federal money from the American Recovery Plan Act, the ARPA dollars, in building more permanent supportive housing, putting that in the hands of our nonprofit service providers who are mission focused on serving people who've been experiencing homelessness, and then creating those communities, that rental housing community where people can live, and healthcare has places in the building and meaningful activities, and it's just a very service-enriched community so that people can be successful. And the data is very strong. We have nonprofits who meet the benchmarks year after year with like 90% or better of their residents staying housed. So that permanent supportive housing for the chronically homeless, rapid rehousing for folks who've experienced more short-term housing, those are our key strategies layered on with greater access to mental health care. We've not had enough of anything in our community, the scale. We have really good services, but the wait to get them is too long, or they're only available in a crisis, and then you go try to make it until your next crisis. And so we're really looking at how do people have access 24/7 to crisis care, and then a long enough runway with gaining back their stability before they move on back home or to a housing situation. So again, we've invested some of that federal money to help us pilot this 24/7 access to crisis care and a 90-day stay in a therapeutic respite center while you gain the stability to live on your own. I'll add one more thing that I've learned over the years is that you think about a lot of this stuff as sort of a three-legged stool. You got to have money to pay rent. You got to have the housing unit available to you with whatever your situation is, enough bedrooms for your family, or someone that'll say yes even though you have poor rental history or criminal history. And the third one is some support, some services, some help. A lot of times in our communities across the country, you don't have all three legs to the stool the same length or at the same time, and therefore people fall off the stool. And what we're really focused on in Travis County is having all three legs to the stool at the same time.
How much is Travis County collaborating regionally on all these topics?
I think regionalism needs work. We're creatures of our resources and funding streams. Like HUD does not fund the region on homelessness. It funds Travis County. That's how we compete for federal dollars, is as a county applicant. I think one place where we're learning a little more about regionalism, if you will, is through our own local willingness to break down some fiefdoms. With our federal dollars, the ARPA dollars, our nonprofit community is working as a collaboration and saying, we're going to share this money that you're offering up for housing to make sure we can get all the housing built. So if my community gets a grant, we're going to share some of the federal money with a different organization. And I think the more we can exercise those kinds of muscles, it can allow us to see that more regionalism can work, because we know we can share locally, so let's share a little more broadly. Another one I think is by using money from the opioid settlement. Texas is getting money from the opioid settlements. So is Travis County, so is the city of Austin, so is Williamson County, so is Hayes County. And we know that drug use it travels. The drugs are delivered and the people are suffering, and they'll go where they need to go because of their addictions. And so this is another opportunity where we can look at who's doing what. Does your community have Narcan available for stopping an overdose death? Or should we be supplying, like just this sort of holistic look at what's going on? So that's an area where I think we can look regionally. Another one was with addressing veteran homelessness. Again, we were funded as Travis County, but when we were working so hard to help every veteran experiencing homelessness find housing within 90 days. It was a goal set by President and Michelle Obama and the mayors across the country. It was the mayor's initiative with the White House to end veteran homelessness. And we were always so close to hitting the goal, and then we'd have more veterans all of a sudden in our community. And we were like, why is this? Well, what we learned by looking at data is that veterans go to where veteran health care that they need is offered. And you can look up and down the I-35 corridor at communities from San Antonio to Austin to Waco to Dallas, over in LaGrange. Wherever there are veteran services, veterans are coming and going. And so this was a group that was on the move looking for help. I'm a big fan of regionalism, but a lot of the funding streams don't allow us to do it that way. So this is something that we as county leaders could work more together on. And with the federal government, like vouchers are given to a housing authority in a community for that jurisdiction. So if you're trying to help a veteran get housing and he can't afford Austin housing, but that's where we have the voucher, it doesn't really do him any good. But if he or she could use that voucher in Bastrop or LaGrange, or it doesn't work that way. So you're just hitting a hot button on regionalism. I can't say we've done a lot, but I think we could, and I know the problems are regional, but the solutions I don't think yet are.
I know you talked a little bit about the integration of mental health services with homeless services. And it sounds like there's quite a few other components that are integrating with that. Are there any efforts to specifically raise awareness about mental health in the community and reduce the stigma associated with seeking help?
One of the outgrowths of COVID was a recognition that many people battle mental illness. It allowed us to drop some of the stigma around mental illness, to talk about brain health, about people getting help for what they need. And I think when you layer on top of that recognition that mental illness can be loneliness, I mean, there's a lot of things that feed into that. Then you layer on the opioid crisis, where we have a lot of healthcare challenges. We're having people of all ages deal with their opioid addiction. So to me, it's all connected, and we've partnered the county with the city, with Austin Public Health, and with our local mental health authority to spend money on awareness campaigns to parents of school-age children about talking to their children about how they feel, about talking to them to the dangers of fentanyl and these hidden poisons in drugs, so that people aren't trying pills at a party without knowing it could be extremely costly. And so that sort of just connection about mental health and drug use and getting parents to talk to their young people, because we have had overdoses at high schools across the community, and it's just tragic.
That campaign was effective, actually. I did have my conversation with my elementary age children about that, which is crazy to think about, but it's important.
Right.
How is the county prioritizing funding for mental health services, especially in the wake of rising demand?
Yeah, for one, we're really collaborating with our hospital district. Here it's called Central Health. The county appoints board. It's a statutorily created thing by the state. Lots of counties in Texas have hospital districts. So this is our hospital district. We appoint board members to it, so does the city. And talking with them about spending more money on mental health, because we have a local mental health authority that gets a lot of state funding. My understanding was the mental health authority did mental health, and the hospital district helped fund more primary care and specialty care. But they're not limited to that. They also can fund mental health services in the community and add money to the local mental health authority. You know, a lot of this is looking at how do we leverage resources to scale up whatever it is our community needs. Quite the partnership now going on between our hospital district and our mental health authority and the city and the county. We're spending a lot of money on increasing access to health care, including mental health care. You know, in the last 15 years, I guess, our communities have experienced some turnover in funding sources. Our listeners will know a lot more than maybe I do, but the Medicaid waiver situation, it's called the 1115 waiver, and you could do creative things of investing locally and get money that was matched by the federal government, and we really expanded services for mental health into schools, make sure we had mental health professionals available in schools or clinics that were integrated care. But that program has gone away, and so now you have to figure out what to fund at the local level. Then we had the ARPA money, which has been really helpful, but now that money's going away. And so it is a constant hunt for money to provide these services. And I think here in Austin Travis County, because we've experienced a lot of growth in our population, we're not only having to braid and knit the public dollars, but hope that our private healthcare system grows also. We're fortunate to have a new medical school called the Dell Medical School at the University of Texas, expanding their capacity. Our university is building 2 new hospitals. The Ascension Seton Hospital System is expanding a mental health hospital. The state of Texas has rebuilt our psychiatric hospital here, the Austin State Hospital. But we need to add more components to just the continuum of care for health care and including mental health care. So it's a lot of growing pains in our community. We're experiencing it everywhere. And so I think just the whole healthcare industry needing to grow is part of our solution here. Because then the public healthcare sector, if you will, has a bigger playing field, more doctors, more nurses, more clinics, and we can there can be a better movement, I think, between public and private healthcare.
That makes sense. And also circling around to the judicial system, how are we tying the mental health in the court system to all of these new resources that the county is working with the city on?
It's probably our number one focus because it's an area where the county is so responsible. It's our mandate from the state constitution to provide the jail and to help with health care for people in poverty. And so where those two things come together, many of our jails across the state of Texas are the largest mental health care provider in that community. So we are focused on diverting people when they first come in contact with law enforcement away from the criminal legal system and into the healthcare system. We want treatment instead of incarceration. And we're not to say we don't want to deal with the behavior that got someone in trouble. But if the onset of that behavior is a mental health crisis, we want to divert them away from jail and into treatment. And we're envisioning now how we rebuild our central booking facility to include a mental health assessment. And we haven't worked out all the mechanisms with the court system. Does someone get booked but diverted, or diverted and then booked? It's referred to as deflection versus diversion. There's a lot of magic and devil in the details, right? But we're committed to getting people out of jail that have a mental illness and preventing people from getting locked up who would be doing so just because there's nowhere for them to go. So we're working this from sort of all the angles, and we're really grateful again for that federal stimulus money that's helping us pilot some of these things to see what the next step is.
What are your final thoughts to county officials and citizens listening right now?
I often say that we don't need rocket scientists to address homelessness. Homelessness is about housing and health care and support that help someone maintain their housing. We've got to look at why people are not housed. What are those barriers? And break down the barrier. If it's because too much of your rental housing says we won't take anybody with a criminal history, that doesn't work for our country. We're a country of laws where if you pay your time, then you're released and you're back in community. We need to welcome those people in community and make sure they have safe and decent places to live. We need to be laser focused on breaking this cycle of street to jail to emergency rooms. It's expensive for our communities. Way back when I first started working on homelessness over a decade ago, the federal government put a price tag of $40,000 a year per person on your street. That's what it was costing your community to leave that person on the street. They go to the hospital, they need EMS, they need police. So doing nothing is expensive. Doing something changes the scene. And so do something. Get involved with your community around building supportive housing, and I think we'll all be better off.
Thank you for tuning in to this episode of Texas County Voice, and a big thanks to Commissioner Howard for her insights about homelessness and mental health care. County judges who want to learn more about addressing mental health are encouraged to attend TAC's Judicial Forum on Mental Health scheduled for January 9th through 10th in Austin. Find additional education and training events at county.org. Till next time.